This is to inform all employees on how to handle incidents involving bloodborne pathogens and to educate on how to work around these hazards without getting infected. The goal is to empower employees with the authority to take over a situation involving bloodborne pathogens and the confidence to apply the measures presented in this training to protect the health and safety of other employees and clients. Expected results. All employees should become aware of how to handle emergency situations in regards to bloodborne pathogens and learn what measures to take to prevent themselves from and others from being exposed. Approximately 5.6 million workers in the healthcare and other facilities are at risk of exposure to bloodborne pathogens such as human immunodeficiency virus, the HIV, the virus that causes AIDS, the hepatitis V virus, HBV, and the hepatitis C virus, HCV. OSHA bloodborne pathogen standards prescribe safeguards to protect workers against the health hazard from exposure to blood and other potential infectious materials, and to reduce the risk from this exposure. Who is covered by this standard? All employees who could be reasonably anticipated as a result of performing their job duties to face contact with blood or other potential infectious materials. A Good Samaritan act, such as assisting a co-worker with nosebleed, could not be considered an occupational exposure. Some workers who are at risk: physicians, nurses, and emergency room personnel, orderlies, housekeeping personnel and laundry workers, recovery advocates and technicians, paramedics and emergency medical technicians, anyone providing first response medical care, medical waste treatment employees, and home health care workers. How does exposure occur? Most common is needle stick, cuts from other contaminated sharps such as scalpels, broken glass, etc. Contact of mucous membranes, examples the eyes, the nose, the mouth, or broken cut or abrased skin with contaminated blood. Exposure control plan identifies jobs and tasks where occupational exposure to blood or other potential infectious material occur. Describe how the employer, the grove, will use engineering and work practice controls. Ensure the use of PPE, which is personal protective equipment. Provide training. Provide medical surveillance. And provide hepatitis B vaccines, which we will touch on later. And use signs and labels. Exposure control plan. Written plans required. Plan must be reviewed at least annually to reflect changes in tasks, procedures, or assignments which affect exposure and technology that will eliminate or reduce exposure. Annual review must document employers' consideration and implementation of safer medical devices. Must solicit input from potential exposed employees in the identification, evaluation, and selection of engineering and work practice controls, and plan must be accessible to employees. UPs, universal precautions. Treat all human blood and certain body fluids as if they were infectious. Must be observed in all situations where there is a potential for contact with blood other than a potential infectious material. Engineering and work practice controls. There are the primary methods used to control the transmission of HBV and HIV. When occupational exposure remains after engineering and work practice controls are put in place, personal protective equipment, PPEs, must be used. Engineering controls. These controls reduce employees' exposure by either removing the hazard or isolating the worker. Example, Sharps disposal containers, self-sheeting needles, and safer medical devices. Example as needleless systems, Sharps with engineering sharp-ended protections. Safer medical devices, needleless system, a device that does not use needles for the collection or withdrawal of blood, fluid, or the administration of medication or fluids. Sharps with engineered sharps injury protection is a non-needle sharp or a needleless needle device used for withdrawal of blood, fluids, or in the administration of medication or fluids. Sharps with engineered sharps injury protection is a non-needle sharp or a needle device used to withdraw body fluid, assessing a vein or an artery, or administering medication or other fluids with the built-in safety feature or mechanism that effectively reduces the risk of exposure. Work practice controls. These controls reduce the likelihood of exposure by altering how a task is performed. Examples. Wash hands after removing gloves and as soon as possible after exposure. Do not bend or break the sharps. No food or smoking in work area. PPE is personal protective equipment, specialized clothing or equipment worn by an employee for protection against infectious materials. Must be properly cleaned, laundered, repaired, and disposed of at no cost to the employee, and must be removed when leaving an area and upon contamination. Examples of PPE: gloves, gowns, face shields, eye protection, mouthpiece. Again, personal protective equipment. Housekeeping. Must develop a written schedule for cleaning and decontamination at the work site based on the location within the facility, the type of service to be cleaned, the types of soil to be cleaned, present, tasks or procedures being performed. Housekeeping again, work surfaces must be decontaminated with the appropriate disinfectant. After completion of the procedures, when surfaces are contaminated, and at the end of each work shift. You should always be sure that your workstation is clean. Must be placed in regulated waste. Must be placed in a leak-proof container built to contain all contents during handling, storing, transporting, or shipping, and be appropriately labeled or color-coded. We use a company called Cintas, so everything is separated and they pick it up to be sure that nothing gets cross-contaminated. Laundry. Handle contaminated laundry as little as possible and use PPE. Be sure you use gloves, face masks, whatever you need. Must be bagged or containerized at the location where it is used. No sorting or rinsing at the location where it is used. Must be placed and transported in a labeled or color-coded container. Hepatitis B vaccine requirements. We used to make this available to our employees. The vaccine right now is very hard to get a hold of and it's very expensive. When you open a vial, it's 10. If you don't have 10, you just wasted about $300. So we advise that if you want to go get the hepatitis B vaccine, please contact your primary care physician. It's a 2-shot series. Must make available free of charge at the reasonable time and place to all employees at risk of exposure within 10 working days of initial assessment, unless the employee has had a vaccination, antibody testing has revealed immunity. The vaccination must be performed by a licensed healthcare professional. Again, you can go ahead and ask your primary care physician to get these in sequence. I myself had it done because of the population that we serve. Again, it's just really strongly suggested that if you don't have hepatitis V vaccine, that you get vaccinated. Must be provided even if employee initial declines later but decides to accept the vaccination. Employees who decline the vaccination must sign a declination form. Employees are not required to participate in the antibody pre-screening program to receive vaccination series, and vaccination boosters does not be provided if recommended by the U.S. Public Health Service. Again, we follow CDC guidelines, so we follow their recommendations. What to do if an exposure occurs? Wash exposed area with soap and water. Flush splashes to nose, mouth, skin with water. Irrigate your eyes with water or saline solution. Report the exposure. Direct the worker to the healthcare professional. If you or your coworker is exposed, please go let medical know. If they, for some reason, cannot get there, please help them out and get them some medical attention. Post-exposure follow-up. Document routes of exposure and how exposure occurred. Record injuries from containment sharps in a sharps injury log, if required. I'm here to tell you that we do have sharps injury logs on property. They are at the nurse's station along with policy and procedure books. So we do have logs for the CDC and for LDH if need be. Obtain consent from the source individual and the exposed employee and test blood as soon as possible after the exposure incident. We do use a facility called CPL. They are on property. I'm here to tell you that if you get stuck with a needle or anything like that, and we feel that you are at jeopardy, we will take you down straight there into the lab and be sure that that blood is drawn so we can protect you as an employee. Provide risk counseling and offer post-exposure protective treatment for disease when medically indicated in accordance with current U.S. Public Health Service guidelines. Biohazard warnings. Warning labels required on containers or regulated waste, refrigerators and freezers containing blood and other potentially infectious materials, other containers used to store, transport, or ship blood or other potentially infectious materials. Red bags or containers may be suitable for labels. Again, we use a company called Centos. We also have CPLR Lab, so you will see red sharps containers around the facility. Training requirements provided at no cost to employees during work hours. We provide at time of initial assessment to a job with occupational exposure and at least annually therefore after. Additional training needed when existing tasks are modified or new tasks are required, which affect the worker's occupational exposure. Maintaining training records for 3 years. Our training records we maintain for 3 years. And our training elements consist of copy of the standards, modes of transmission, site-specific exposure plan, hazardous mitigation, use of engineering controls, work practices, and PPE use, medical record keeping requirements, employee's name and social security number, employee's hepatitis B vaccination status, result of examination, medical tests, and post-exposure evaluation follow-up procedures, healthcare professional's written opinion, information provided to the healthcare professional. Employee medical records must be kept confidential and not disclosed or reported within the employee's written consent unless required by law. Medical records That's if you get anything that you have to be seen for, must be maintained for duration of employment plus 30 years according to the OSHA rule governing access to employees' exposure and medical records. We have to report this to LDH and the Office of Medical Health um, as far as what happened and what did we put in place for you. Sharp's injury log. The sharp injury log. Employers must maintain a sharp injury log for the recording of injuries from contaminated sharps. The log must be maintained in a way that ensures employees' privacy. It must contain, at a minimum, the type and brand of device involved in the incident, the location of the incident, and the description of the incident. And this is just to summarize what we just went over. OSHA's bloodborne pathogen standards prescribe safeguard to practice workers against the health hazards from exposure to blood and other potentially infectious materials, and to reduce their risk from this exposure. Implementation of this standard not only will prevent hepatitis cases, but also will significantly reduce the risk of workers contracting AIDS, hepatitis C, or other bloodborne pathogens. Welcome to the Grove.